Chief Medical Officer of Health Theresa Tam has released her annual public health report, and while it's supposed to be all about the state of public health in Canada, instead, it is full to the brim with social justice jargon. In October, Canada's Chief Medical Officer of Health, that's Theresa Tam, released Canada's report on the state of public health in 2023, titled Creating the Conditions for Resilient Communities, a Public Health Approach to Emergencies. It's basically just a manifesto written by Pfizer's CEO Albert Bourla, pledging allegiance to the World Health Organization's global health architecture and the idea of One Health. There is an entire page dedicated to a land acknowledgement before detailing an emergency management continuum that has 4 sections. The first, prevention and mitigation. That includes refining of community resilience to address equity and power. Second, preparedness, which includes healthy public policy during emergencies, inclusive community partnerships, and planning for equity. Third is response, creating supportive environments to promote health and enable behavior change. Strengthening trust and social cohesion, of course, while integrating equity into response processes. And finally, recovery, to build resilience into, well, recovery. Document mentions UNDRIP, that's the United Nations Declaration to the Rights of Indigenous People, several different times. It also refers to that health organization's One Health approach, saying that health promotion includes prerequisites such as peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity. By preparing for healthy public policies, Tam's report says that action on healthy public policy can help reduce the extent of an emergency's direct and indirect impacts on health and the determinants of health, boost resilience, and enable health-promoting behaviors. In the first ever acknowledgement of the harms caused by COVID-19 related public health disaster that I've seen, have a look at this. The COVID-19 pandemic demonstrated the importance of addressing the broader social and economic impacts of an emergency, including those unintentionally caused by necessary public health interventions. The report further states that the COVID-19 pandemic also underlined the need to bring a human rights perspective to understanding and addressing the inequitable impacts of emergencies. But they don't mean like the chartered rights infringements, such as when the government-sanctioned COVID-19 public health measures stole children's rights to access a free in-person public education, or when police and government harshly infringed on people's mobility rights and then monitored their movement without their knowledge or consent, and when they further violated freedom of assembly by stipulating arbitrary social bubble provisions, violated the right to protest through those same rules, literally trampled on people's right to economic freedom through public health sanctioned business closures.
We need this car! We need this car! Move back! Get back! He's got my wrist, bro! Get back! I'm just adjusting these guys. Shame on you, brother!
That forced and siphoned everyone to line up outside of big box stores while they kept the liquor stores open but closed the gyms for your health. The final nail in the coffin for deranged breaches of human rights was the lack of individual autonomy or consent involved with community masking, which pivoted within a year to mass injecting novel mRNA biopharmaceutical products into the arms of trusting Canadians. On that note, the report happily states that Tam's agency was able to curb the monkeypox outbreak in Montreal in May of 2022 through, you guessed it, vaccination awareness campaigns such as disseminating information through social media and a dating app. This apparently resulted in over 30,000 Quebecers getting an mpox vaccine. To reinforce the necessity of a behavioral science team at the Public Health Agency of Canada, the report says that the COVID-19 pandemic demonstrated that behavior change can be enabled through supportive environments and that additional interventions may be necessary for those who experience barriers to adhere to emergency response recommendations. Some examples of supportive environments are described as increasing options for physical distancing in congregate living environments, virtual healthcare, mobile testing sites, culturally appropriate food boxes for households experiencing food insecurity, safe voluntary isolation sites, changes to the built environment, and eviction moratoria. Tam thinks that supportive information environments are particularly important to help counter mis- and disinformation. Mis- and disinformation can apparently lead to increased polarization, decreased public trust, lower adherence to public health advice, and illness and death from preventable diseases. A study estimated that mis- and disinformation contributed to vaccine hesitancy for an estimated 2.3 million people in Canada between March and November 2021. By November of 2021, without these refusals or delayed vaccinations, there could have been an estimated 198,000 fewer COVID-19 cases, 2,800 fewer deaths, and 299 million saved in hospital cost. I took the liberty of finding that study, and it is, of course, junk science. It's based on a modeling study that predates the Omicron variant, where vaccination status became pretty much irrelevant. It's a pretend play simulation that blatantly ignores real-world data and real-world happenings. Since faulty modeling that never came true was proving to be ineffective in the long term to keep people terrified into submission, to build trust and confidence and quell that vaccine hesitancy, Tam deployed a campaign in Quebec called the Laval Awareness Brigade. It utilized community outreach to share information on testing and public health measures and raise awareness about the importance of the COVID-19 vaccine. It is currently being evaluated as part of a research study that explores how outreach community practices can support health and social services. Naturally, Tam's report continues to urge Canadians to receive the latest COVID-19 mRNA formulations every 6 months. Her way forward emphasizes equity in emergency management policies, plans, and technology, urges for increased resources for public health systems and communities to support well-being during emergencies. It also has a specific focus on recognizing Indigenous knowledge and practices. The frilly, meaningless words just show how hypocritical this report really is. It's chock full of social justice jargon with very little tangible insight on how to uphold previously well-established pandemic response plans, why they were disregarded for this knee-jerk hysteria, and instead it pledges allegiance to global health architecture and the World Health Organization's One Health approach, which they say requires shared databases and surveillance to work. This contradicts local community-driven initiatives, favoring instead a pharma-captured top-down health approach, whereas genuine health results from patient-centric, patient-driven care. For Rebel News, I'm Tamara Ugolini. Theresa Tam repeatedly failed Canadians throughout the COVID-19 pandemic, and this nonsense report reinforces the lack of tangible priorities at the Public Health Agency of Canada. If you would like to see Tam terminated for the repeated fumbling and mismanagement, then visit our website at firetam.com. You can sign our petition, sign up to our mailing list, and chip in a few bucks if you appreciate this kind of work at firetam.com.